Thank you for giving me the opportunity to talk about the pandemic and its relationship to allergy and allergic disease. Unfortunately, the media has deluged people with information, half information, and there's a great deal of false information. If you're going to be able to dissect out fact from fiction and understand what the rationale is behind the sensible approach to this pandemic, then you do need to understand a bit more about the science. And that means understanding the immune system a little better and the way in which it works, which I think will help you to begin to make sensible decisions about how to proceed for your own future health. So I will try and move on. So the first thing is to describe the immune system, and it is an incredibly clever system, almost as clever as the brain, because it learns from experience and adapts as a result of that experience, and then has memory for that adaptation. So when you're first exposed to an infection, there is an initial, very rapid, innate response. And then subsequently, there is a more effective adaptive response. And that latter adaptive response is remembered, leading to long-lasting protection against subsequent infection. There are checks and balances so that the response stops once the infection is cleared to avoid collateral damage of the immune system then overreacting and beginning to damage you. However, like our brains, the immune system can misinterpret an experience by failing to react to a danger signal, and that will either lead to the infection overwhelming you, or this is one of the components that underlies susceptibility to cancer, with the immune system not recognizing rogue cells and eliminating them. The other option is that instead of failing to react, there is an overreaction after the infection is cleared, or alternatively, that the immune system reacts to a harmless exposure, thinking that it might be dangerous. And that's equivalent to so-called friendly fire, and that underlies consequences of some of the consequences of COVID, but also is fundamental to allergy and to autoimmune disease. Now, you also need to be aware that, like the brain, memories can fade, and that there is a need for reminders, and that's ever more important as you get older and the memory in the immune system fades. So if we look at the sequence of events, we have an infection, and the microbe, prior to you having any symptom, builds up in numbers, and then on day 0 you start to have symptoms, and hopefully with a normal immune response, the system eliminates the organism progressively. The innate immune response comes in very, very quickly, within hours, and certainly within the first 1 or 2 days. And that innate response already begins to reduce the microbiome load, the microbe load. So you're already beginning to improve. And then the adaptive response kicks in, and that's first with recruitment of various white cells, and I'll go into that in a little more detail shortly. And then eventually, quite a long time after that, you begin to generate antibodies, and the immune system generates its own memory, which can be laid down and remain dormant until the next exposure to the bug, when it will activate very quickly and come in as quickly as the innate response and prevent infection from ever causing you any problem. So what about the microbes that you need to deal with? Are they all your enemies, or are there some that are allies? So some are clearly enemies, and we usually call those pathogens. Those are damaging organisms, damaging to you, that is. But there are others that are allies, and there is a normal human microbiome, and I'll come back to that. So there are 3 groups of pathogens that survive in your body, but don't predominantly penetrate into cells: parasites, molds, and bacteria. One group of pathogens only thrive and reproduce when they're inside your cells. and those are viruses like COVID. Medicines that aid clearance of parasites, molds, and bacteria, such as antibiotics, are relatively safe because they don't have to go into the cell and can kill outside the cells. But they may also kill your allies, the normal human microbiome. Antivirals are more difficult to develop because they must get into the cells and kill the virus without damaging cells. And that's taken some time to evolve. So let's go to our allies, the normal human microbiome. Believe it or not, you have 10 times more bacteria than human cells in your body. That means you're 90% bacteria and only 10% human. There are over 200 different bacterial species that live in you and on you, and they live in an ecological balance, and they're modified by an enormous number of factors. Antibiotics clearly will get rid of many of those organisms. Changes to your diet will modify those in your gut, but there are many other environmental factors involved. So what about this microbiome? Well, there are an enormous number of beneficial effects to you. We live in a symbiotic relationship with our own microbiome. They improve digestion, they aid vitamin synthesis and absorption, they stimulate beneficial immune responses, they help to prime the immune system appropriately, and they inhibit pathogens from colonizing the skin, the gut, the respiratory tract. And actually, we now know from research that alterations to the microbiome have an impact on risk of developing allergy and autoimmune disease, and probably a number of other conditions. Even obesity is associated with an altered microbiome. So let's now look at the way in which the immune response is generated to a mold or a bacterial infection. So the organisms come along and they begin to start damaging the superficial cells where they land. And those cells generate a message, because once they're being damaged, they release chemical messages saying, help, we're being attacked. These are substances that have been grouped as a group called alarmins. And these substances stimulate the immune system, and they particularly stimulate a group of lymphocytes, which then start sending out their own signals saying, come in the army. So for a bacterial infection, the most important initial response is for the neutrophils, white blood cells, which are cells which can eat and kill organisms, to begin to be activated. And of course, then reinforcements are the antibodies which can bind to the bacteria and molds and facilitate their elimination. So that's how you respond to a bacterial infection. But of course, COVID-19, like viruses, has no nucleus and can only reproduce inside tissue cells. So how does the COVID get into the cell? Well, all viruses have an access point to be able to penetrate into a cell. And for COVID, the access is through a substance known as Angiotensin Converting Enzyme-2, ACE2, which is on the lining of airways, gut, blood vessels, and kidney. And COVID sticks to this particular protein, which then allows it to be pulled into the cell. Once in the cell, the virus takes over the cell processes to multiply. So it uses the cell's metabolic processes and subverts them to begin to reproduce itself. And the viruses replicate, and eventually the cell dies. And then the viruses are released to infect more cells and spread further around the body. So what are our innate weapons to block COVID-19? Well, there are a whole series of substances which that group as a group are known as defensins, which attach to the virus and aid its elimination, stop it sticking to the access molecules, and they're in the circulation on the surface of many cells and inside cells, which is a very important initial protection. But there is a big but. These defensins as groups are very much affected by comorbidities. So if people have other conditions, the efficiency of these defensins is reduced, which explains some of the susceptibilities that occur to COVID. Inside the cell, there are additional responses. So the cell will recognize there's a danger posed by the virus and will send signals to the nucleus to generate interferons. So out come the messenger RNAs, and interferons are produced. And interferons, and a whole group of them, can aid killing of the virus, but they also induce something called programmed cell death or apoptosis. And this is where the cell metabolic processes just close down completely, so the virus can't reproduce anymore. And then the cell slowly involutes, holding the virus inside so that it can't be released. There's no more virus uptake or reproduction or release. And then those cells that have now died with the virus held inside are then eliminated by other processes. And that's a very efficient and rapid onset system for those who are healthy and have no comorbidities. So you can begin to appreciate that there's a battle going on now between the body, the host, and the virus. And that battle will, in various ways, disrupt replication. But that, unfortunately, means that there are going to be times when mutations will occur in the virus. These are occurring continuously, and they mostly have no impact whatsoever in terms of the virus infectivity or anything else. But they do aid mapping of spread through communities, and that's how the world has been able to monitor how the virus has spread, because all the time there are slight little changes to the genetic structure of the virus, which can be monitored and see how it's passed through communities. But by chance, there will occasionally be variants of concern, either because they're more pathogenic or more infectious or vaccine resistant. And the latter two, that is being more infectious or vaccine resistant, is much more beneficial to the virus because it allows it to spread and survive and become dominant. And the worst thing to do is for the virus to actually kill you, because, as an example, Ebola never spread beyond its places of origin because it's killed people too quickly and therefore it reduced its own capacity to spread. The number of new variants appearing is directly proportionate to the number of people who are infected and who are not immunized. It's an example of Darwinian evolution occurring incredibly rapidly, where environmental pressures are leading to viruses that have developed through mutation, some resistance to those environmental pressures, which are the vaccine and also the innate immune responses. Now, the Delta variant, which everybody's become familiar with worldwide as the most dominant variant at the moment, is certainly more infectious than the previous variant, but it isn't more pathogenic. Omicron, I note I've spelt it with a K, not a C. That's more appropriate for the Greek lettering. The Omicron variant is certainly more infectious, but there is a strong possibility that it's less pathogenic. Now, this is exciting. If this trend, if continued, will evolve into COVID-19 being no more severe than flu. And so this could be a godsend to the world if this proves to be the case. But the only concern that we have yet to resolve is it more vaccine resistant? Because that might harm the elderly and vulnerable who are not as well protected, and then it might still be damaging. So the properties that people are looking for that are of concern in a variant are, does it bind more strongly to this ACE2 that I've already described? But the other concern is that it might be able to attach to other cell surface molecules, and therefore it has even more access. It might overcome the intracellular innate immune protection. It might suppress adaptive immune responses, which of course everybody's familiar with in relation to HIV, or which is the final concern, it's no longer recognized by the immune response to vaccines or to previous infections with different variants. The World Health Organization, I think it's worthwhile understanding how they've classified variants. They start off by classifying variants of interest that they think might be a problem, and then if they deem that it is a problem, it becomes a variant of concern. The alpha variant had 2 mutations in the spike protein, which increased its infectivity. The beta variant, which theoretically it originated from Southern Africa, had 3 mutations, one of which was common with the alpha, and again appeared to be a bit more infectious. The gamma variant from Brazil had 3 mutations, 2 common with beta, a little bit more infectious, but this did not gain any kind of hold worldwide because the Delta variant came along from India and had 3 mutations, all unique, which was clearly very, very much more pathogenic and became dominant. Now, what happened to the next few Greek letters from epsilon to mu? They were labeled of interest, but eventually were not considered a concern, so you don't hear about them. So now we're presented with the next variants. And the World Health Organization, in their wisdom, thought that mu would not be suitable, mu variant, people would misinterpret that. And Z, they didn't like that letter. So the next letter was Omicron. And I've again spelled it with a K because, you know, this is a Greek letter, C doesn't fit. Anyway, there are 10 mutations at the end of the spike protein that bind to ACE2, and there are a load more other mutations elsewhere in the virus, effects of which we still don't know, but there is a possibility that it might have, those other mutations might have reduced pathogenicity. So what we don't know so far is how transmissible, but certainly now the evidence accumulating is that there is increased transmissibility. We're hoping it's reduced pathogenicity. We're also hoping that the vaccines will still work and the research is going on. You will know the results of that within the next 2 or 3 weeks. These are data that have just been generated from Gauteng province about the 4 waves of COVID. And each of the waves, the first wave was a huge wave, and that was the original virus, and then there was beta, delta, and then Omicron, which I've now spelt incorrectly. So the interesting thing is looking at the infectivity, looking at the frequency with which the numbers infected double. And you will see for the first wave 1.3, beta it was 1.7, third wave it was 1.5, but the fourth wave, that is the Omicron wave, it's 1.2, and you'll see that as the little green line just at the start. And it's a very, very steep rise, so no doubt about its increased infectivity. So how does it affect us? Well, it's really the a tip of an iceberg when you hear about deaths and severe cases, because a high percentage of people don't have any problem at all, which varies by age. The younger the person, the less severely affected. Anywhere between 10 and 25% of young people and children are not affected. They have a short period of having the infection without any symptoms. Amongst those with symptoms, the majority have a mild flu-like illness, a few have a more severe illness, an even smaller number are admitted to hospital, smaller number still requiring intensive care, and the fatality rate overall across the world has been 2%, but that's based on the whole of the pandemic. That fatality rate has gone down progressively with improved management. The symptoms: loss of taste and smell, pneumonia, neurological impairment, gastroenteritis, kidney failure, thrombosis, a big problem. And then there are hyperinflation syndromes where the virus triggers the immune system to overreact, and then that's damaging us. So as of yesterday, the pandemic facts are that there have been, based on PCR positivity worldwide, 267 million cases. Well over 5 million people have died as a result of getting this infection. That's 2% overall. The research suggests that the above numbers are almost certainly more than double that, because 50% of cases have either been untested or have negative PCRs on the one occasion they are tested. So we're talking about well over 10 million deaths and well over 500 million confirmed cases. The worst records in terms of number of cases and of deaths are USA, India, Brazil, and UK in that order in terms of numbers. South Africa has done remarkably well considering the vulnerability of the population and is 18th in the world list, both for number of cases and number of deaths per head of population. So that is good. And the SA success has predominantly been due to early, continued and effective implementation of mask, social distancing and sanitizing, and that has been something that has been enforced and still is in place today, and that has been an enormous success. So let us feel very positive about what's happening here by comparison with what you might think were far more sophisticated developed countries. So let's think more about our allies. So a healthy immune system, being physically fit, having a healthy balanced diet and lifestyle, and there's a lot of good sense that's required. Certainly smoking can be damaging and increases risks. Social distancing has now been established by studies in many parts of the world to reduce infection rates by a very high percentage, up to 87% from cumulative data. The wearing of cloth face masks has reduced the infection rate by 84%. So those are the two most important public health measures. The data on hand washing is less clear. It certainly reduces infection rate, but the difficulty is combining that with additional factors which have not been unfortunately recorded. And that is not touching unclean surfaces without skin cleansing before you touch your mouth, nose, or eyes, because that is where, if you pick it up from a surface and then touch your face, you're introducing the infection. So hand washing must occur before you do that. So congratulations, the winner is common sense, your immune system, and your microbiome, because that will reduce risks of infectivity and will have primed your immune system. So what about immunizations? Very important. Let us be absolutely clear. This is Edward Jenner injecting cowpox into people to reduce the risk of developing smallpox. And we have no doubt that improved socioeconomic circumstances and immunizations are the two greatest beneficial changes that have reduced infections and improved health worldwide. Vaccinia immunization eliminated smallpox completely, and polio is almost gone. There are several safe and effective vaccines for COVID, and immunization will without doubt reduce your risk of severe illness and death and will increase protection for those around you. And in my view, it is a civic responsibility to ensure you're immunized, not just for your own benefit, but for the benefit of your community, your family, but in the end, for the benefit of the world. The vaccines that are available, there are different groups, mRNA vaccines, which are enclosed in a lipid envelope, Pfizer and Moderna, something called an adenovirus vector vaccines, that's AstraZeneca, Oxford vaccine, and the Janssen vaccine. But there are a number of other vaccines coming along, inactivated virus, subunit, and actually the ones that probably for the long-term future will be the most exciting and likely to change the whole perspective of immunizations is nanoparticle vaccines. Early trials are in progress, and those are very easy to make worldwide, and it'd be possible to have them everywhere very, very rapidly if they prove to be effective. So those are all positive messages. I'd just like to give another little message to the anti-vaxxers saying, oh, it does lots of damage. You've all heard of placebo, but the opposite of placebo, that's benefit from having a dud treatment. There is nocebo, that is the damage. And there are a whole series of vaccine trials. And if you look at what's happened to people who were given the dud vaccine, who reported symptoms, fatigue, headache, muscle aches and pains, pain at the injection site, and swelling at the injection site. And quite a high percentage of people are reporting symptoms to nothing, which perhaps gives you some idea of the mind over matter and issues. Do not believe the stories about the damaging effects of the vaccines. Yes, the tiny 1 in a million people do have reactions to vaccines. That's common to all vaccines, not specific to the COVID vaccine. And those are in people that have very significant pre-existing predispositions to having adverse responses, not just to vaccines, but to the infections as well. Allergic reactions to COVID vaccines can occur 1 per million injections for the approved vaccines. It's a little bit higher for the Pfizer vaccine than the others, and that's because the Pfizer and indeed also the Moderna vaccine contains something called polyethylene glycol, and a very tiny number of people are allergic to PEG, and that is people who have multiple, not single drug allergies, because PEG is in a number of medications, or have multiple but not single food allergies because PEG is in some manufactured foods. But it's only if people react to many, many different products that there's any potential for PEG to be involved. For everybody else, go ahead and get your vaccine, it won't be a problem. But even for those with these severe allergies, the vaccine can be safely administered in a specialist service, and there are now studies that have shown that. So it's still possible to go ahead. So allergy really is not an issue for the immunization. There's also a lot of other good news. There are effective weapons to deal with the acute and more severe infection. Steroids with dexamethasone has revolutionized management of the more severe patients. There are now a number of antiviral agents that are being developed, which are becoming effective and have been approved. And one example is remdesivir. And even more exciting are a whole series of what are known as monoclonal COVID antibodies that are humanized antibodies that can be administered by infusion in people who are acutely ill and are making a big difference in improving survival. And now, even for those who are susceptible, for those with more severe problems, there are some new antivirals. Those two listed there have just been approved by the UK for use. And also, interestingly, inhaled steroids that are used to treat asthma can reduce severity of infection if given early on in those with a milder illness. So we're really working on it, and there are lots of good things happening. I now want to move on, because the one group of infections that I haven't talked about immunologically are parasites. There is a tapeworm that lives in your gut and feeds on what you eat, to the extent that if you want to lose weight, you could infect yourself with a tapeworm. Of course, it's going to do damage as well, so you don't want tapeworms. So how does the body deal with tapeworms? The parasite releases enzymes to digest its way between the epithelial cells in your gut to anchor itself there. Now, the cells, again, release messages, help, I'm being attacked by some rather large organism, but now this is far too big for lymphocytes and neutrophils to have any impact whatsoever. This is a macroorganism, not a microorganism. So what's the defense here? You need to bring in the big guns. And the big guns, via the lymphocyte responding, is to bring in a group of cells now as eosinophils. And these eosinophils have proteins within their granules within the cell that, when released, are poisonous to the parasite. They paralyze the parasite. They also cause the cells that have been damaged by the parasite to be shed and released into the bowel. so that the parasite is no longer anchored and therefore can be cleared by normal gut mechanisms. The other thing that happens is that reinforcements are brought in, and the specific antibody that is also important for activating even more eosinophils and other cells which can be damaging to the parasite is an antibody known as immunoglobulin E, not the immunoglobulin G that we've seen for bacterial infection. But IgE is the allergy antibody, and eosinophils are the cells which cause chronic inflammation in those with allergic diseases. So the identical immune response that is there to help you eliminate parasites, sadly, is the immune response that increases your risks of becoming allergic. Allergic diseases are the commonest long-term condition affecting up to 30% of the whole world population. They're increasing in prevalence worldwide. They pose a huge health economic burden, and they're significantly affected by early life environment, nutrition, what allergic factors you're exposed to, pollutant exposure, and most importantly, microbial experience. Allergic diseases are highly controllable, so we have not a lot of treatment, but they aren't curable. Once they've developed, they tend to be sustained because the immune system has memory and sadly carries on remembering that you're allergic to something. But it may be possible to manipulate the early environment to prevent the disease, and that's a big focus of research now. The mechanisms of allergy are that it's a hypersensitivity reaction which occurs following the primary sensitizing exposure. In other words, it's an adaptive response that I've explained before. IgE is the main mechanism for causing most of the common symptoms, but there are other immune mechanisms involved through eosinophils. It is identical to the normal response to infection, but it occurs because the immune system misinterprets harmless proteins as being a danger, in some way mimicking the effect of the proteins that come from parasites, and then leading to an inflammatory response. And the conditions that are associated with allergic disease are in infancy, eczema, food allergy that often follows, the development of sensitization to aerolized allergens such as pollens and house dust mites, which then can lead on to hay fever, allergic rhinitis, and to asthma. And that's the allergic march. And a lot of people will go through a sequence of each of those in succession. The commonest allergen is to the house dust mite, followed by cat, followed by pollens, followed by dog, followed by molds, and then foods. So this is an area which I've been heavily involved with studying over many years, as indeed is my wife. And this is the ideal mite 3 environment. That building at the end of the lake used to be the summer residence for the ex-Italian royal family. It is now an institution for children with severe asthma who are not doing well with schooling and are admitted to there to be in school throughout the school year, and they only go home during the summer holidays. And the interesting thing is that this is an environment at very high altitude. Just over the next valley is Cortina, but this is a little valley known as Misurina. It's very low humidity. There are no house dust mites, there are no pets, there's no pollen exposure, there's no pollutants, and when the children are at school, there are no parents. And those result in enormous improvements in lung function and exercise tolerance, very little asthma despite reductions in preventer and reliever treatment. It is the perfect environment for people with asthma and allergic rhinitis, and indeed also to a significant extent eczema. So how can we reproduce this in a home environment? That has been a struggle for many, many years. I've recently been involved with doing some studies with a system known as temperature-controlled laminar airflow, which is a device over the bed of people, and it creates a completely particle-free area around the breathing zone. This is a smoke-filled room, and you can see the smoke being deviated from around the face of the person lying there. It causes a huge reduction in particle exposure, and from studies that we did, 30-fold reduction in cat allergen in the air around the face. And actually we put filters in the nose of people sleeping on cat allergen-laden bedding, and there was a 7-fold reduction in the amount of cat allergen that got into the nose when the device was on compared with not being on. And our trials have shown huge improvements in rhinitis and asthma, and now there's some trials going on in eczema, which also look very exciting in reducing severity considerably. Those are actually our publications. Now, just to come back to early life, Samuel Taylor Coleridge, ancient mariner, he wrote, "The history of man from the 9 months preceding birth would probably be far more interesting and contain events of greater moment than all the 70 years that follow it. Never more true than related to allergic disease. Factors that increase allergic disease are obesity in the mother and the child, pregnancy, smoking, antibiotics given in late pregnancy, cesarean section delivery, bottle feeding rather than breastfeeding, an unbalanced diet during pregnancy." The latter is very important to say because attempts to avoid common allergy-provoking foods does not work, and it actually unbalances the diet and increases risks of allergy, not decreasing. The 3 factors that I'm highlighting here are antibiotics in late pregnancy, cesarean delivery, and bottle feeding, all result in very considerable differences in the infant's gut microbiome, which in turn increases the risks of allergy. So those are things that we can do. We can avoid antibiotics unless absolutely necessary. Cesarean section should only be reserved for medical reasons, not for cosmetic or suitability reasons, or breastfeeding should be the predominant way in which any baby is fed. Cow's milk is for cows. One other thing, smoking is the biggest avoidable health hazard. Is King James I of England and VI of Scotland, a custom loathsome to the eye, hateful to the nose, harmful to the brain, dangerous to the lung. Never more true. Unfortunately, being exposed to tobacco smoke during pregnancy, either because the mother smokes directly or because the father smokes around the mother, increases the risks to the infant of sudden infant death, of respiratory tract infections, of asthma, and even there's some data showing it impairs growth and educational attainments. Now, the hygiene hypothesis or microbial exposure hypothesis suggests there is a mutually exclusive relationship between allergy and infection, or more importantly, the normal human microbiome. And certainly if you look at trends to infectious diseases over the second half of the 20th century, they are all diminished enormously at the same time as autoimmune and allergic diseases have gone up: asthma, type 1 diabetes, multiple sclerosis, Crohn's disease, to name but a few. But it's more related not to having kill or cure and having some nasty infection, it's to what we're normally exposed to in our environment. And believe it or not, children conceived and raised on farms have the lowest risk of allergy and asthma, despite the fact they're exposed to more allergens than anybody else. And that is because their microbiome is more appropriate to ensure that they have a normal primed immune response. So our obsession with hygiene has maybe gone a bit too far, and allowing children to roll around in the garden is far more appropriate than trying to stop them. So now, why am I, as a pediatric allergist, involved with COVID research, which I have become involved with very intensely over the last 2 years? I've been seeing patients whose allergic problems have increased after COVID infection. And it became very clear that some of the mechanisms by which viruses such as COVID are eliminated by the immune systems includes an allergic pattern, which I've hitherto just described in relation to parasites. And when you begin to look at the published data And now the work that my wife Jill and colleagues and I have been doing into the effects of COVID on people with and without asthma and allergy, you begin to see that there are some important messages. This is the history of one patient of mine. She had hay fever during the tree pollen season. For many years, she was allergic to birch pollen. She had an itchy mouth and tongue when eating fresh apples, but cooked apples didn't cause a problem. And actually, provided she ate apples regularly, it was too minor a problem, and she rather liked eating apples. It's known as pollen food syndrome. It's a very mild allergy, and it's due to the fact there are some proteins in fresh apple that are identical to those in the pollen, but they only cause minor symptoms. In November 2020, she had a mild COVID infection with 1 day of fever and temporary loss of taste. In spring 2021, her hay fever was 100 times worse. She then ate an apple in June, and she had an anaphylactic reaction to the apple. That is a life-threatening reaction. So why was the COVID infection mild, and the subsequent apple allergy evolved from a mild to a severe and even life-threatening problem? Well, part of the innate immune response to COVID is that the signals that are released stimulate a group of cells known as innate lymphocytic cells with a type 2 phenotype. You don't need to worry about that, but the important thing is they activate eosinophils, the allergy cells. Eosinophils cause shedding of the infected cells like they do to let the parasite be released, so those shells then die and are cleared away. But the eosinophil also has the capacity to begin to attack and kill the virus because it has various molecules on its surface which can bind to the virus and begin to destroy it. So it's part of the allergic early response. And those people with allergies, interesting how lower ACE2 levels, which reduces the capacity of the virus to get into the cells. And also they're able to increase their eosinophil counts when infected with COVID, which results in a milder disease. People with asthma have reduced risk of developing COVID infection if they have allergic asthma, and tend to have less severe infection. And that has been established in a number of studies. Of course, there are then lots more cells that are brought in, the natural killer cells, B cells to develop the antibodies, and neutrophils, a whole orchestra to begin to challenge the virus. So that's the good side of having an allergy-biased immune response, but is there a downside, the friendly fire effect? Because eosinophils, when they release their proteins, and that's an eosinophil in the bloodstream, disrupting and releasing its proteins, if that's not controlled after the infection is cleared, those proteins can begin to damage tissues around the body. And our studies have shown that pre-existing asthma and allergy, while reducing acute COVID infection, do increase the risk of long COVID. Long COVID has been established in many countries now to be a problem that is of persistent symptoms 3 to 6 months after the infection is cleared, more in those that have been hospitalized, but even in those with mild or asymptomatic infection, up to a quarter of adults have developed long COVID symptoms. This is a study in children that I've been involved with, looking at various symptoms over the months after recovery from illness in COVID infection, proven hospitalized children. And you'll see that slowly over time, by 6 to 7 months, symptoms have declined, but there's still a significant percentage have fatigue, sleep problems, hair loss, etc. And 25% have at least one persistent symptom 5 months after discharge. So this is a big problem for the long term with this illness. The risks based on our studies in adults are being female rather than male, more in females, having a positive rather than negative PCR, which means that the infection has persisted for longer and is more easily detected. Pre-existing asthma has increased risks. And for children, there's no gender effect. 2 to 5 year olds, there's not much of an increased risk, so they appear not to have this problem. But age 6 to 18, there is a risk, and it is significant. Pre-existing food allergy and asthma increase the risks of long COVID in children. So, what about the research now? Well, immune mechanisms to understand the causes and potential treatments to mitigate this friendly fire effect are looking at various autoimmune mechanisms which may be involved, to how enhanced allergic immune responses might be involved, and also to one of the components of long COVID is the development of microclots, which may be initiated by increased eosinophil activity. And there's a professor in Stellenbosch University that's particularly focused on research in this area. Allergic people are reporting increased severity of a range of symptoms, and this is now being studied in larger cohorts, and so certainly something I've been involved with. So I leave you with the message that, of course, from the good, the bad, and the ugly, COVID is clearly bad. But allergy, whilst being good in terms of causing less severe infection, might unfortunately have an ugly side effect of increasing the risk of long COVID. But my final message is, don't panic. Employ common sense, get immunized and now boosted. South Africa are now commencing the boosting program. The outlook for those with infection has dramatically improved. There's many new drugs and vaccines being developed. And therefore, for the future, I think that things are looking good. And actually, the natural evolution of the virus may take it from its current damaging properties to something that is much less severe. Thank you very much.